The smell hits me first. Not the antiseptic burn of hospital corridors or the metallic tang of blood I've grown used to in my 6 months at St. Halsted. This is different. Charred flesh mixed with something sweet and acrid, like caramelized sugar left too long on a flame. It clings to the back of my throat as I push through the ER doors, and I know before seeing anything that this case will stay with me. Reyes! Trauma Bay 3, now! Dr. Sarah Chen's voice cuts through the chaos. She's one of the senior attending physicians here, a woman whose calm under pressure I've tried to emulate since day one. But right now, even her voice carries an edge I haven't heard before. I run. The automatic doors to Trauma Bay 3 slide open, and the scene stops me cold for half a heartbeat. A man lies on the gurney, his right arm elevated, wrapped in what looks like kitchen towels soaked through with something dark and glistening. His face is contorted, not in a scream but in something worse, a tight, controlled grimace that speaks of pain so intense it's moved beyond sound. "Just save my right hand," he gasps through clenched teeth. "Please, just my right hand." His left hand grips the rail of the gurney so hard his knuckles have gone white. The monitors beep steadily but fast. Heart rate 142, blood pressure 168/95. His body is trying to outrun the pain. But what makes my stomach drop isn't the vitals. It's what I can see beneath those soaked towels as a nurse carefully begins removing them. The burns don't stop at his hand. 48 hours earlier, I wouldn't have recognized the warning signs of what I'm looking at now. 48 hours earlier, I was just finishing a quiet night shift, thinking about the difference between textbook medicine and the messy reality of human bodies that refuse to follow protocols. My attending that week, Dr. Marcus Webb, had pulled me aside after I'd sutured a simple laceration on a construction worker's forearm. "Clean work, Reyes," he'd said, examining my stitches with the critical eye of someone who'd done 10,000 of them. "But you're thinking about the wound. You need to think about the person." I'd nodded, not entirely understanding. "That guy builds houses for a living. Those hands are his livelihood. You gave him perfect cosmetic stitches, but did you ask about his work? Did you think about range of motion, grip strength, whether scar tissue might limit his flexibility? Medicine isn't just fixing what's broken, it's preserving what matters." The words hadn't fully landed then. They land now as I watch this man. I glance at the chart. Rafael Delgado, age 47. Clutch at consciousness and repeat like a prayer. "Just save my right hand. Just save my right hand. Doctor." Chen is beside me, her hands already gloved, pulling back the towels with practiced efficiency. 3rd-degree burns, possible 4th degree in the palm and fingers. Exposure time approximately 8 to 10 minutes based on paramedic report. "Reyes, what's the first priority?" My mind races through protocols. Airway, breathing, circulation. But she's testing me on something more specific. "Fluid resuscitation," I say. "Parkland formula based on total body surface area burned." "Good. And?" I look at the arm again. The skin is white in places, charred black in others. There's no bleeding, which should be reassuring, but isn't. It means the burn went deep enough to cauterize blood vessels. "Escharotomy if there's circumferential burning causing compartment syndrome." "Better. Start 2 large-bore IVs. Run lactated ringers. I need a TBSA assessment in the next 3 minutes." She's already moving, her hands working with the kind of muscle memory I hope to develop someday. "And someone find out exactly what happened." A paramedic steps forward, a young woman with soot on her uniform. "Kitchen fire at Corazon del Fuego. That new Latin fusion place on 5th. Grease fire got out of control. He was trying to move a pot of burning oil when it spilled. Witnesses say he held on for several seconds before dropping it." Several seconds. In burn time, that's an eternity. I'm placing the first IV when Raphael's eyes find mine. They're dark brown, bloodshot from pain and smoke exposure, but focused with an intensity that makes me pause. "You understand?" he asks, his accent thick with both pain and something else. Desperation. I'm a chef. My hands, they are everything. My right hand, it knows things my brain doesn't. 15 years of training, 20 years of practice. That hand, it makes magic. The IV slides in clean. I tape it down and reach for his left hand, the unburned one, and squeeze it gently. "We're going to do everything we can," I tell him, and I mean it, but the words feel hollow against what I can already see, because the burns haven't just reached the surface. They've gone deeper, much deeper. The rulebook says to stay detached, to see patients as cases, problems to solve, puzzles where you match symptoms to treatments and hope the outcome is favorable. But no one tells you how impossible that becomes when someone looks at you with their entire future in their eyes and asks you to save the one thing that makes them who they are. Dr. Chen works with precision, debriding the worst of the damaged tissue to assess the depth. Rafael has been given fentanyl, enough to dull the edge but not enough to put him out. We need him responsive for the initial assessment. Talk to me about what you see, Reyes, Dr. Chen says without looking up. I move closer, forcing myself to look past the horror of it and into the clinical reality. Third-degree burns covering the entire palmar surface of the right hand, extending to the wrist. Fourth-degree burns probable on the thumb, index, and middle fingers. Visible exposure of... I pause, my throat tight. Visible exposure of flexor tendons on the index and middle fingers. Charring extends to the metacarpals. The tendons are white and glistening, like wet rope pulled too tight. They should be covered by layers of skin, fat, and fascia. Instead, they're exposed to air, vulnerable to infection, to desiccation, to destruction. Rafael is watching me. He hears every word. Can you save it? He asks. Dr. Chen doesn't answer immediately. She's probing gently with forceps, testing tissue viability. Finally, she looks up at me, and I see something in her expression I haven't seen before. A kind of sad acknowledgement. Mr. Delgado, she says, her voice gentle but firm. The burns are severe. The tendons in your fingers are exposed, and there's extensive damage to the underlying structures. We're going to do everything possible to preserve function, but I need you to understand that this isn't just about saving the hand. It's about preventing infection, managing pain, and giving you the best possible outcome. The best possible outcome is my hand works, Rafael says through gritted teeth. I don't care about pain. I don't care about scars. I need my hand to work. There's a silence in the trauma bay, the kind that happens when everyone knows what needs to be said, but no one wants to say it. I think about Dr. Webb's words, about preserving what matters. But what do you do when what matters might already be gone? They take Rafael to surgery 40 minutes later. Dr. Chen leads the team. A plastic surgeon, Dr. Richard Park, is called in along with an orthopedic hand specialist, Dr. Jennifer Okafor. I'm invited to observe, which at this stage of my residency is both an honor and a test. The OR is cold as always. The lights are brutally bright, turning everything into sharp relief. Rafael is intubated now, unconscious, his burned hand elevated and prepped on a sterile field that looks too small for the magnitude of what we're trying to preserve. Dr. Park examines the hand under magnification. I can see his jaw tighten. The flexor digitorum profundus tendons are exposed on digits 2 and 3, he says into the recorder mounted above the table. Partial thickness loss on FDP digit 4. Extensive full thickness burns to the thenar eminence. Questionable viability of the radial artery. Dr. Okafor adjusts the microscope. Metacarpal exposure on 2 and 3. Periosteum appears intact, but thermal damage is evident. They speak in the careful, neutral language of surgery. But I'm learning to read between the lines. This is worse than we hoped. The surgery lasts 6 hours. I watch as they debride dead tissue, carefully preserving anything viable. They irrigate with liters of sterile saline, removing every trace of contamination. When they reach the tendons, Dr. Park works with instruments so delicate they look like they belong in a jeweler's workshop, not an operating room. The problem, Dr. Okafor explains to me during a brief pause, is that tendons don't have great blood supply to begin with. They're tough, designed to transfer force, not to heal quickly. When you burn them, you're not just dealing with surface damage, you're compromising their ability to regenerate. And if infection sets in, she doesn't finish the sentence. She doesn't need to. They wrap the hand in a specialized dressing, layers of antimicrobial mesh, moisture barriers, and finally a splint to keep everything immobilized in what they call the position of function. Fingers slightly curved as if holding a ball, thumb opposed, wrist in neutral. It looks like Rafael is preparing to catch something, or maybe letting something go. When they wheel him to recovery, Dr. Chen finds me outside the OR, pulling off her surgical cap. You did well in there, she says. Stayed focused, asked good questions. Will he cook again? I ask. It's the question that's been burning in my mind for hours. Dr. Chen looks at me for a long moment. I don't know, Reyes. Honestly, I don't know. We saved the hand. It's still attached. Tissue is viable for now. But function? That's going to depend on how he heals, whether infection develops, how the tendons respond to physical therapy. It's going to be months before we know anything definitive. He's a chef, I say, as if she doesn't know. That hand is his identity. I know. She puts a hand on my shoulder. And that's what makes this hard. We can fix anatomy. We can repair structures. But we can't promise someone they'll get back what they lost. Sometimes the best we can do is give them a chance. A chance. It doesn't feel like enough. Rafael wakes up 6 hours post-op. I'm there when his eyes open, checking his vitals on the night shift rotation. The hand is elevated, wrapped in so much dressing it looks twice its normal size. An IV runs pain medication and antibiotics in a steady drip. His first word is, "How?" Just that. How? I know what he's asking. The surgery went well, I tell him. Dr. Park and Dr. Okafor removed all the damaged tissue and preserved the viable structures. Your hand is still there, Mr. Delgado. The tendons, we did everything we could to protect them. Can I move it? Not yet. You need to stay immobilized for at least 2 weeks while the initial healing happens. Then we'll start gentle range of motion exercises with physical therapy. He's quiet for a long time, staring at the ceiling. Then, I need to tell you something. I pull up a chair, settling in beside the bed. That restaurant, he says, his voice hoarse from the intubation. Corazon del Fuego. That was mine, my dream. I saved for 10 years to open it. Every penny, every sacrifice. My wife, she worked 2 jobs so I could go to culinary school. My daughter, she wore secondhand clothes so we could afford better ingredients. He pauses, swallowing hard. I opened 6 months ago, finally, after everything. After all those years of working in other people's kitchens, making other people's dreams come true, it was mine. And it was working. People were coming. Critics were noticing. I had a review scheduled for next week. A real critic, from the Times. This was supposed to be when everything changed. The monitors beep steadily. Outside the window, the city is dark. Just a few scattered lights in windows where other people are living through their own crises, their own moments of before and after. The fire, I prompt gently. Stupid, he says, and there's anger in his voice now. So stupid. A prep cook, new kid, he panicked when the oil got too hot. Tried to move the pot instead of using the suppression system. I saw it happening and I just reacted. Grabbed the pot, thought I could save it. Save the night, save the review, save everything. He laughs, but it's a broken sound. 8 seconds. The paramedics said I held that pot for 8 seconds before I dropped it. 8 seconds that might cost me everything I've built. I don't have words for this. Nothing in medical school prepared me for the weight of someone else's shattered dreams sitting heavy in the space between us. Why did you hold on? I finally ask. Rafael turns his head to look at me and his eyes are wet. Because letting go meant failure. Meant my restaurant burns down, my dream burns down, everything I sacrificed for burns down. I thought if I could just hold on long enough, save that one pot, maybe everything would be okay. But it wasn't oil you were saving, I say quietly. It was burning you. I know. He closes his eyes. I know that now. The next 48 hours are critical. Burns are strange injuries. Unlike a broken bone that you set and expect to heal in a predictable time frame, burns continue to evolve. The damage doesn't stop when the heat source is removed. Cells die in waves, some immediately, others over hours or days as inflammation and compromised blood flow finish what the fire started. We call it the burn wound conversion. It's why we watch so carefully, why we change dressings frequently, why every sign of infection sends us into high alert. On day 2 post-op, I'm doing rounds with Dr. Webb. He's reviewing Rafael's chart with the kind of thorough attention he gives every case, but I can see the concern in the way his finger taps against the clipboard. Temps up, he notes. 101.8. White count? I pull up the latest labs on the computer. Elevated, 14,000. Could be normal post-surgical inflammation, Dr. Webb says, but his tone suggests he doesn't believe it. Or it could be the start of something worse. When's the next dressing change? Scheduled for this afternoon. Move it up. I want to see that hand now. We go to Rafael's room together. He's awake, talking quietly with a woman I recognize from the photos on his bedside table. His wife, Elena. She's holding his unburned hand, and they both look up when we enter with expressions that mix hope and dread in equal measure. Mr. Delgado, Dr. Webb says warmly. I'm Dr. Webb, one of the attending physicians. I'd like to take a look at your hand if that's all right. Rafael nods, and I see him squeeze his wife's hand before letting go. The dressing comes off in layers. The outer bandages look clean, but as we get deeper, I notice a smell, faint but distinct. Not the clean, antiseptic smell there should be, but something slightly sweet and off. Dr. Webb's expression doesn't change, but I've learned to read the tiny tells, the slight tightening around his eyes, the way he leans in just a fraction closer. The hand itself is swollen, more than it was yesterday. The exposed tendons are covered with the special synthetic mesh they placed in surgery, but around the edges, the tissue looks wrong. Too red in some places, too pale in others. Dr. Webb probes gently with a sterile swab. Rafael winces but doesn't cry out. Pain on a scale of 1 to 10? Dr. Webb asks. 7, Rafael says. Maybe 8. Worse than yesterday? A pause. Then, yes. Dr. Webb looks at me. Reyes, what are we seeing? This is a teaching moment, but it's also real. My answer matters. Increased erythema and edema, I say, keeping my voice clinical even though my heart is racing. Possible signs of infection. The exposed tendons appear viable, but the surrounding tissue shows signs of compromised perfusion. Treatment? Broad-spectrum antibiotics, culture the wound, consider surgical debridement if infection is confirmed. Good. Dr. Webb turns back to Rafael. Mr. Delgado, I'm concerned about signs of infection developing. We're going to start you on stronger antibiotics and monitor you very closely. If things don't improve in the next 24 hours, we may need to take you back to surgery to clean out any infected tissue. Rafael's jaw tightens. Will that hurt my chances of the hand working again? Dr. Webb sits down on the edge of the bed, and I recognize this posture. It's the one he uses when he needs to have hard conversations. I'm going to be honest with you, he says. Every surgery, every complication, every infection, they all affect healing. Your hand sustained severe trauma. The fact that we were able to save it at all is significant, but the road ahead is long and uncertain. Right now, my priority is preventing this infection from spreading. Function comes second to survival. Survival, Rafael repeats the word like it's foreign. My hand is surviving? Your hand, and you, Dr. Webb says gently. Severe infections can spread quickly. Sepsis is a real risk. I need you to understand that we're fighting on multiple fronts here. Elena speaks for the first time, her voice steady despite the tears on her cheeks. Do what you need to do, doctor. Save him. The hand, we'll deal with the hand. But Rafael is shaking his head. No, you don't understand. Without this hand, I'm not a chef. I'm not who I'm supposed to be. The room falls silent except for the steady beep of monitors. Dr. Webb looks at Rafael for a long moment, then stands. Identity isn't in your hand, Mr. Delgado, he says quietly. It's in here. He taps his own chest. What makes you a chef isn't the physical ability to hold a knife. It's the knowledge, the creativity, the passion. Those things don't burn. It's a kind thing to say. I'm not sure Rafael believes it. The infection gets worse. Despite the antibiotics, despite the careful wound care, despite everything we throw at it, the bacteria have found a foothold in damaged tissue, and they're not letting go. On day 4, Rafael spikes a fever of 103.2. His hand is angry red and swollen to twice its normal size. The synthetic mesh we placed over the exposed tendons has begun to separate as the underlying tissue breaks down. The smell is unmistakable now, the sickly sweet scent of necrotic tissue. Dr. Park is called back in. He examines the hand with a grim expression. We're losing ground, he says bluntly. The infection is tracking along the tendon sheaths. If it reaches the carpal tunnel, we're looking at a potential systemic spread. So, what are our options? Dr. Chen asks. We're in the conference room just outside Rafael's room. Me, Dr. Chen, Dr. Park, Dr. Webb, and Dr. Okafor. Dr. Park pulls up the latest imaging on the screen. The CT scan shows dark streaks along the tendons, pockets of fluid and gas that indicate deep infection. We go back in, he says. Aggressive debridement. Remove all necrotic tissue. Irrigate extensively. Possibly place antibiotic beads directly into the wound bed. And if that doesn't work, Dr. Okafor asks the question we're all thinking. Dr. Park's silence is answer enough. Let me be clear, Dr. Webb says. Are we talking about possible amputation? I'm talking about saving this man's life, Dr. Park responds. The hand is important, I understand that. But if we get to a point where the infection can't be controlled with the hand intact, then yes, amputation becomes necessary. The word hangs in the air like a guillotine blade. He's not going to agree to that, I say, and everyone looks at me. I've been talking to him. His entire identity is wrapped up in being a chef, in using that hand. If you tell him you might have to amputate, he'll refuse treatment. Then we convince him otherwise, Dr. Chen says firmly. This isn't about what he wants. It's about what he needs to survive. Is it? I'm surprised by my own voice, by the challenge in it. I mean, at what point do we respect someone's choice about their own body, their own life? Dr. Webb turns to me. You're saying we should let him keep an infected hand because of his emotional attachment to it? I'm saying we should understand that sometimes quality of life matters as much as life itself. The room is silent. Finally, Dr. Park speaks. This is exactly why we have ethics committees. But before we get there, let's try the aggressive debridement. Give him every chance to keep the hand. But I'm putting it on record. If the infection spreads to systemic, if he goes septic, all bets are off. We do whatever it takes to save his life, even if that means taking the hand. Everyone nods. I think about Rafael's words. That hand makes magic. And I wonder if magic can be taught to trust science when science is asking it to let go. They take Rafael to surgery that evening. I'm not in the OR this time. I'm covering the floor, but I get updates through the night. The surgery lasts 4 hours. They remove nearly 30% more tissue than in the first operation, cutting away everything that looks even questionable. When Dr. Park comes out, his scrubs are soaked with sweat despite the cold OR. We got as much as we could, he tells the waiting family. Elena, their daughter Sophia, who's maybe 19 or 20, and Rafael's brother Miguel are all there. The tendons are still exposed, but we've cleared out the infection as best we can. The next 48 hours will tell us if it worked. Will he be able to use his hand? Sophia asks. She has her father's eyes. Dr. Park hesitates. Even in the best-case scenario, there will be significant limitations. The amount of tissue we had to remove, the damage to the tendon structures. I don't want to give false hope, but he'll have his hand? Elena presses. If the infection clears, yes, he'll have his hand. It's not the answer they want, but it's the only one Dr. Park can give. I think about the difference between having something and being able to use it, about the space between physical presence and functional reality. Rafael wakes up angry. I'm there when he comes out of anesthesia, and the first thing he does is try to sit up, try to look at his hand. Easy, I say, gently pressing his shoulder back. You need to stay still. Let me see it. His voice is rough from the breathing tube. Mr. Delgado, let me see my hand. I glance at the nurse, who nods. We help him sit up slightly, adjust the bed so he can see. The hand is there, still wrapped in dressings, but smaller now. You can tell from the silhouette that there's less of it than before. Rafael stares for a long time. How much did they take? He finally asks. Tissue that was infected and dying, I tell him honestly. They saved everything viable. That's not what I asked. I pull up a chair. The tips of your index and middle fingers. Partial tissue from the thumb. Significant debulking of the palm to clear infection. The tendons are still there, still intact, but what? But they're significantly compromised. Even if healing goes perfectly, range of motion will be limited. He's quiet for so long I think maybe he's fallen back asleep. Then, can I hold a knife? It's the question that matters. Not can he write his name, or button his shirt, or shake someone's hand. Can he do the one thing that defines him? I don't know, I say, because lying feels worse than uncertainty. You'll work with occupational therapy. They'll help you adapt, find new ways. I don't want new ways. His voice is sharp. I want my hand back. The way it was. The way it's supposed to be. That's not possible. Then what's the point? The monitors beep. Somewhere down the hall, someone's call light is going off. The normal sounds of a hospital at 2 a.m. The point is you're alive, I say. To do what? Watch other people cook? Teach classes I can't demonstrate? Write recipes I can't test? To be a husband, a father, a brother. To be Rafael Delgado, who is more than just a hand. He turns away from me then, facing the window where darkness presses against the glass. You don't understand, he says quietly. You're young. You haven't put everything you are into one thing yet. You haven't built your entire life around a single skill, a single passion. When that's gone, when that's taken, you're just left with this empty space where purpose used to be. I want to argue, want to tell him he's wrong, but I think about why I became a doctor, about the countless hours of studying, the debt, the sacrificed relationships, the narrow focus required to get here. And I imagine someone telling me I could never practice medicine again. The empty space he's describing suddenly doesn't seem so foreign. You're right, I say. I don't fully understand, but I know this. Purpose isn't given to us. It's not permanent. It evolves. It changes. Sometimes it's taken away and we have to find new meaning. I don't want new meaning. Maybe not right now, but maybe someday. He doesn't respond, and after a while I leave him alone with his anger and his grief, both of which are probably healthier than false hope anyway. The infection clears. It takes 5 days of IV antibiotics and constant monitoring, but slowly, miraculously, the fever comes down. The redness recedes. The swelling decreases. The cultures come back showing decreasing bacterial counts until finally, on day 9 post-initial injury, we're able to say the words everyone has been waiting for. The infection is under control. Rafael's hand survives, but surviving and thriving are different things. Doctor. Okafor starts him on gentle, passive range of motion exercises. I watch one of the sessions, see her carefully flex and extend each remaining finger, working the joints that have been immobilized, testing the damaged tendons to see how much function remains. Rafael's face is a mask of concentration and pain. Good, Dr. Okafor says encouragingly. We're getting about 30% range of motion in the thumb. That's better than I expected. 30%, Rafael repeats flatly. It's early days. With therapy, that could improve to 50, maybe 60%. And we can talk about possible reconstructive procedures down the line. Tendon grafts, nerve repairs. There are options. But Rafael is looking at his hand like it belongs to someone else. The fingers don't curl the way they should. The thumb won't oppose properly. When Dr. Okafor places a foam ball in his palm and asks him to squeeze, his hand barely responds. That's okay, she says quickly. We're just establishing a baseline. Give it time. Time. The word that means both hope and torture depending on how you hear it. I find Rafael on the roof 2 days later. It's against protocol. Patients aren't supposed to be up here. But I've learned that sometimes rules exist to be broken when someone needs space to breathe. He's standing at the railing, his bandaged hand cradled against his chest, looking out over the city. His restaurant is somewhere out there in that sprawl of lights and shadows. You're not supposed to be up here, I say, announcing my presence. You going to report me? Probably should, but you won't. I move to stand beside him. The night air is cool, carrying the smell of distant rain. How did you find me? He asks. Nurse said you weren't in your room. Only so many places to look. We stand in silence for a while, watching the city live its life below us. I went bankrupt, Rafael says suddenly. Got the call today. The restaurant. The damage from the fire. The lost revenue while we're closed. My medical bills, even with insurance. It's gone. Everything. 20 years of saving, building, dreaming. Gone in 10 days. I don't know what to say to that. And my hand, he continues, lifting it slightly. This thing that's supposed to be mine, that's supposed to be me. It's just dead weight now. Can't even grip a pen, let alone a knife. It's been less than 2 weeks. Don't. He cuts me off. Don't give me the optimistic doctor speech about recovery and adaptation. I've heard it. I know the statistics. I know the odds. I know what severed tendons mean, what nerve damage means, what extensive scarring means. Then you also know that improvement is possible. Possible isn't the same as probable, and probable isn't the same as enough. He turns to look at me. You want to know the worst part? It's not the pain. It's not the infection or the surgeries or any of that. It's the fact that I did this to myself. The fire wasn't your fault. Holding on was. Thinking I could control something that was already out of control. 8 seconds. If I had let go after 1 second, maybe I'd have minor burns. 2 seconds. Moderate. But 8? 8 seconds of stubborn pride, of refusing to accept failure, of thinking I could save what was already lost. That's what cost me everything. The rain smell is getting stronger. Storm coming. You were trying to save your dream, I say. My dream killed my dream. It's such a perfect, terrible summary that I almost laugh. But there's nothing funny about the way his shoulders are shaking, about the tears that are finally coming after days of locked-down stoicism. I don't know who I am anymore, he says through the tears. Chef Rafael is gone. Restaurant owner Rafael is gone. All that's left is... What? Disabled Rafael? Failed Rafael? The guy whose hand doesn't work anymore, so he has to find some other purpose, some other meaning. Like I'm starting over at 47 years old? I think about Dr. Webb's words. Identity isn't in your hand, it's in your heart. But I'm starting to understand that knowing something intellectually and feeling it emotionally are oceans apart. You want the truth? I ask. He nods. I don't have answers for you. I can tell you about the healing process, about physical therapy, about the medical probabilities, but I can't tell you how to rebuild a life. I'm 27 years old, 6 months into residency, and half the time I'm terrified I'm going to kill someone through inexperience. Identity crisis? I'm living one. Every day I wonder if I'm actually cut out for this, if I made the right choice, if being a doctor is who I really am or just who I thought I should be. Rafael is listening now, really listening. But here's what I'm learning, I continue. Purpose isn't this fixed thing we find and then hold on to forever. It's more like cooking, actually. You start with ingredients, your skills, your experiences, your passions, and you combine them in different ways depending on what life gives you to work with. Sometimes you have everything you need for the perfect dish. Sometimes you're missing key ingredients and you have to improvise. That's a terrible metaphor, Rafael says, but there's the ghost of a smile on his face. I'm a doctor, not a poet. Clearly, we're quiet again, but it's a different kind of silence, less heavy. My daughter, Rafael says eventually, Sophia, she wants to go to culinary school. I've been saving for years to send her. But now that money is gone too. She says she'll work, take out loans, but I wanted to give her what my parents couldn't give me. A head start, a chance without the burden of debt. Does she know that? About the debt? She knows about the restaurant. No. Does she know that you wanted to give her a head start? That you've been saving for her? He shakes his head. Maybe tell her. Maybe knowing that matters more than the money. Maybe. The first drops of rain start to fall, light and hesitant. We should go inside, I say. 1 more minute. So we stand there, 2 people at very different stages of life, but somehow in the same place of uncertainty, letting the rain begin to wash over us. And I think about how sometimes the only thing you can offer someone is your presence in their pain. Sometimes that's enough. The next 3 weeks are hard. Rafael develops a depression that's textbook. Decreased appetite, difficulty sleeping, flat affect, withdrawal from family. We consult psychiatry, start him on medication, recommend therapy. He goes through the motions, but there's no light in his eyes. The physical therapy continues. Slowly, grudgingly, his hand improves. 40% range of motion in the fingers, 50% in the thumb. He can grip a cup if someone places it in his hand, though he can't pick it up on his own. He can't hold a knife, not in any way that would allow him to cook. I stop by his room most days, usually late at night when the floor is quiet. We don't always talk. Sometimes I just sit there while he stares at the TV or out the window. Sometimes we discuss medicine. I find that he's curious about the science of healing, about how bodies repair themselves, about the mechanisms we use to help them along. One night, about 3 weeks into his recovery, Rafael asks me something unexpected. How do you deal with failure? He says, eyes still on the television, but clearly not watching it. I consider the question carefully. What kind of failure? Any kind. When you lose a patient, when you make a mistake, when you do everything right and the outcome is still wrong. I think about the pediatric code I ran last month, the 8-year-old with an undiagnosed heart condition who arrested in the ER. How we worked for 40 minutes, cycling through every protocol, every drug, every intervention. How I did perfect CPR. I know because Dr. Chen told me so afterward. How it didn't matter. I don't deal with it, I admit. Not well anyway. I replay it over and over. I wonder what I missed. I lose sleep. I question whether I'm cut out for this. But you keep going. I keep going. Why? I lean back in the chair, looking at the ceiling tiles. Because the alternative is giving up. And giving up means all the people I could have helped in the future don't get that chance. One failure doesn't negate all the potential successes. Rafael is quiet for a long time. Then, what if the failure is permanent? What if there are no future successes in that area? Then you find a different area. Just like that? No, I say honestly. Not just like that. It's grieving first. Anger, denial, bargaining, all the stages. But eventually, if you want to keep living instead of just existing, you have to find something new to care about. I'm not ready for that yet. I know, but maybe I will be. Someday. It's the first time I've heard him acknowledge a future beyond his current pain. It's a small thing, but small things matter. One night, I bring him a medical journal article about tendon grafting procedures. Why are you showing me this? He asks. Because there might be options down the road. Experimental procedures. It's not hopeless. Experimental means risky. It also means possibility. He reads the article slowly, his damaged hand resting on the blanket. When he's done, he looks up at me with something I haven't seen in weeks. Curiosity. This surgeon, he says, pointing to the author. Dr. Helena Voss. She's in Germany? Yes, She's pioneering new techniques for tendon reconstruction using 3D printed scaffolds and stem cell therapy. Have you contacted her? No, I didn't think. Could you? It's the first time he's asked for something since the infection cleared. The first time there's been a spark of hope. I can try, I say. Do it. Dr. Voss responds 3 days later. Her email is professional but warm. She's reviewed the case files I sent, with Rafael's permission and proper HIPAA compliance. Her assessment is cautious but not dismissive. The damage is extensive, she writes, but not unprecedented. I've worked with similar cases. The question is not whether improvement is possible. It is. The question is whether the potential benefit outweighs the risk and cost of the procedure. The cost is substantial. Experimental surgery in Germany isn't covered by insurance. We're talking $200,000 minimum, possibly more depending on complications. Rafael doesn't have $200. He doesn't have $2,000. When I tell him, I watch the light that had started to return fade back to darkness. Of course, he says. Of course it costs that much. Why would anything be easy? There might be ways, grants, fundraising. Dr. Reyes, he holds up his damaged hand. Look at this. Really look at it. Even if by some miracle I could afford the surgery, even if it worked perfectly, I'd still be looking at months of recovery. More physical therapy, more pain, more uncertainty, and at the end of all that, maybe I get 60, 70% function back. Maybe. Maybe is better than definitely not. Is it? Or is it just another way to torture myself with hope? I don't have an answer for that. But later that night, I find myself researching medical fundraising platforms, GoFundMe, medical grant foundations, culinary associations that help injured chefs. I make a list of possibilities knowing that Rafael probably won't pursue them, but wanting to give him options anyway. Because sometimes giving someone options is all you can do, even if they don't take them. Rafael is discharged 6 weeks after the initial injury. He goes home with a prescription for pain management, a referral for outpatient physical therapy, and a follow-up appointment in 2 weeks. His hand is still bandaged, still weak, still a shadow of what it was. I help him with the discharge paperwork, walk him and Elena down to the hospital entrance where Sophia is waiting with the car. Thank you, Elena says, gripping my hand with both of hers, for everything, for saving his life. The surgical team saved his life. You cared, she interrupts. You saw him as a person, not just a patient. That matters more than you know. Rafael extends his left hand for a shake. His right remains tucked against his side, a constant reminder of what was lost. You're going to be a good doctor, he tells me. You already are. Don't lose that. Don't lose what? The part of you that sees people, not cases, not problems, people with lives and dreams and fears. The part that sits with someone on a roof in the rain because they need to not be alone. That's the part that makes you more than just technically competent. That's the part that heals. I don't trust myself to speak, so I just nod. They drive away, and I stand there watching until the car disappears into traffic, carrying Rafael toward whatever future he'll manage to build from the ashes of the one that burned. Dr. Webb finds me still standing there 10 minutes later. You get attached to that one, he observes. Yes. Why? I think about it. About Rafael's passion, his pain, his desperate clinging to identity. About watching someone's entire world collapse and being powerless to stop it. Because he reminded me what's at stake, I finally say. We fix bodies, but we don't always fix lives. And sometimes we can't fix either one, no matter how hard we try. Dr. Webb nods slowly. That's the hardest lesson in medicine. You can do everything right and still lose. You can follow every protocol, make every correct decision, and the outcome can still be tragedy. How do you live with that? By remembering the ones you do save, by focusing on what you can control, and by understanding that sometimes just being present in someone's pain is its own form of healing. You did that for him, Reyes. You were present. That matters. We walk back inside together, back into the controlled chaos of the hospital where the next crisis is already unfolding, where someone else needs saving. The hospital continues its eternal rhythm, codes being called, babies being born, lives being saved and lost and forever altered. And I carry Rafael's story with me like a weight I'm learning to bear, because that's what we do. We carry the stories of the people we couldn't fully save, and we let them teach us how to be better for the next person who needs us. 3 months later, I get an email. It's from an address I don't recognize, but the subject line stops me cold. Update from Corazon del Fuego. I open it. Dr. Reyes, you probably don't remember me, but I'm Rafael Delgado. You helped treat my father after his accident. I wanted to reach out because I thought you'd like to know what's happened since he left the hospital. It's been hard. Dad went through a really dark period. I won't lie. There were days I wasn't sure he was going to make it, not from the physical injuries, but from the depression. He wouldn't talk about cooking, wouldn't even watch cooking shows on TV. He barely spoke to any of us for weeks. But then something changed. A journalist heard about his story and wrote an article about him, about the chef who lost his restaurant and his ability to cook in the same fire. The article went viral. People started reaching out. Other chefs, cooking schools, restaurants, they wanted to help. One chef in particular, Marcus Chen from Restaurant Oriole, offered Dad a position. Not as a line cook, he couldn't do that work anymore, but as a consultant, a recipe developer, someone who could use his knowledge and creativity even if his hand couldn't do what it used to. Dad almost didn't take it. He said he couldn't bear to be in a kitchen if he couldn't cook. But Mom convinced him to try. Just try. He's been working there for 6 weeks now. And Dr. Reyes, he's coming back to life. He creates recipes, teaches techniques, mentors young cooks. His hand still doesn't work right. It probably never will fully. But he's found a way to be a chef that doesn't require what he lost. He's even talking about writing a cookbook. Cooking with limitations or something like that. Recipes designed for people with physical challenges. He wants to help other people who've lost function in their hands still experience the joy of cooking. I'm starting culinary school next month. Dad's going to help teach a class there once a week on adaptive techniques and kitchen safety. We're doing it together. I wanted you to know because you were there in the worst moment. You saw him when he thought his life was over. I thought you should know it wasn't. It was just changing. Becoming something different than what he planned, but maybe something just as important. Thank you for caring. Thank you for seeing my father as more than just an injury. Thank you for being there on that roof when he needed someone to understand. With gratitude, Sophia, I read the email 3 times, feeling something tight in my chest gradually loosen. Then I forward it to Dr. Webb with a simple note. Thought you'd want to see this. His response comes 5 minutes later. This is why we do what we do. Even when we can't give them back what they lost, we give them time to figure out what comes next. Never forget that time is a gift, too. I save the email in a folder I've started keeping. Reminders of why. It's a small collection so far. Notes from patients who survived. Thank you cards from families. Moments that remind me that this impossible, exhausting, heartbreaking work matters. Rafael's story goes in there right at the top. A reminder that healing isn't always about restoration. Sometimes it's about transformation. I see Rafael one more time, purely by chance. It's 4 months after his discharge. I'm grabbing coffee at a shop near the hospital, one of those rare 15-minute breaks in a 30-hour shift, when I hear a familiar voice behind me. Make sure the crema is thick. If it's thin, the espresso was pulled too fast. Temperature is everything. I turn. Rafael is there, standing with a young barista, demonstrating something about coffee preparation. His right hand is still visibly damaged. The fingers don't curl properly. There's obvious scarring. The thumb sits at an odd angle, but he's using it in conjunction with his left to show the proper technique. He sees me, and his face breaks into a genuine smile. Dr. Reyes! We shake hands, his left gripping mine firmly, his right resting at his side. I heard you were doing well, I say. Your daughter emailed me. She told me. I should have done it myself, but I needed time to figure out what to say. How to explain that you were right. About what? About purpose evolving. About finding new ways to be who you are even when the old ways are gone. He gestures to the coffee bar, to the young barista watching our interaction with curious eyes. This is Marco. He's training to be a barista, but he wants to learn cooking too. I'm teaching him. Not in a restaurant kitchen. I can't work those hours anymore. Can't handle the physical demands. But here, in small moments, I can share what I know. He holds up his damaged hand, looking at it with something that isn't quite acceptance but is closer to peace. This hand, it can't do magic anymore. Not the way it used to. But it can still point, still guide, still show someone else how to make magic. And you know what? That's worth something. That's worth a lot, actually. That's worth everything, I say. We talk for a few more minutes before my pager goes off. An admission coming in, trauma case, all hands needed. As I turn to leave, Rafael calls after me. Dr. Reyes? I look back. Thank you for not giving up on me, even when I gave up on myself. I nod, not trusting my voice, and head back to the hospital, back to the work, back to the next person who needs saving. But I carry Rafael's words with me, his transformation, his proof that even when we can't restore what was lost, We can help people discover what remains. And sometimes, what remains is enough. Sometimes, what remains is everything. It's been a year since that night in the trauma bay, when Rafael Delgado came in clutching his burned hand and begging me to save it. I'm in the residence lounge, finishing up notes from a particularly brutal shift, when I see a package on my desk. No return address, just my name written in careful script. Inside is a book. The cover shows hands, many different hands, young and old, scarred and smooth, dark and light, all working together to prepare food. The title reads, Cooking Beyond Limitations, Recipes and Techniques for Every Body. The author, Rafael Delgado. I open to the dedication page. To Dr. Noah Reyes and the team at St. Halstead Hospital. You saved more than my hand. You saved my ability to see beyond what I lost to what I still had. Thank you for being present in my pain and showing me that healing isn't about going back. It's about moving forward. I flip through the pages. Each recipe is annotated with modifications for different physical limitations, one-handed preparation techniques, adaptations for limited grip strength, alternative methods for people with tremors or reduced dexterity. It's brilliant. It's compassionate. It's the work of someone who transformed their trauma into service. There's a note tucked inside the back cover. Dr. Reyes, 30% of the proceeds from this book are going to a fund I started, the Corazon Foundation. It's for burn victims who need financial assistance with treatment and recovery. I can't give everyone experimental surgery in Germany, but maybe I can help with physical therapy, occupational therapy, adaptive equipment. Maybe I can make the road a little easier for people walking the path I walked. I'm also consulting with a prosthetics company on developing better tools for chefs with hand injuries or amputations. Turns out losing your ability to cook makes you very motivated to help others who face the same loss. My right hand never fully recovered. I have maybe 55% function on a good day, some days less. I'll never do the delicate knife work I used to do. I'll never plate with the precision I once had. I'll never be the chef I was, but I can teach. I can create. I can inspire. I can help other people discover that they're more than their limitations. You asked me once what the point was if I couldn't cook the way I used to. I didn't have an answer then, but I do now. The point is that we're all more than our abilities, more than our skills, more than our physical capacities. We're the sum of our knowledge, our experiences, our willingness to adapt and grow and find new ways to express who we are. Thank you for helping me understand that. Thank you for seeing me when I couldn't see myself. With profound gratitude, Rafael P.S. Sophia graduates from culinary school next month. She's already been offered positions at 3 restaurants. She's chosen Restaurant Oriole, wants to work with Marcus Chen, the chef who gave me a second chance. I'm the proudest father in the world. We're teaching a class together this summer. Multi-generational techniques in modern cuisine. My damaged hand and her skilled one, working side by side. Teaching students that cooking is about more than technique. It's about heart, creativity, and the courage to adapt when life doesn't go as planned. It's perfect. Not the perfect I imagined a year ago, but a different kind of perfect. A better kind, maybe. I sit there in the empty lounge holding this book that represents so much more than recipes. It represents resilience, recovery, redefinition, rebirth. I think about the young doctor I was a year ago, watching a man clutch his burned hand and beg me to save the one thing he thought made him who he was. How terrified I was of failing him. How helpless I felt when I realized that no amount of surgical skill could give him back what the fire had taken. I think about how I've changed too, how every patient teaches me something, how medicine isn't just about fixing what's broken. It's about walking alongside people as they figure out how to live with what can't be fixed. How sometimes the greatest healing happens not in the operating room, but in the quiet moments after, when someone decides to keep living despite everything they've lost. Dr. Webb comes in, sees me with the book. Good one? He asks. The best, I say, and I mean it. He looks at the cover, reads the author's name, and his expression softens into something that might be pride. You made a difference with that one, Reyes. We all did. No, he says firmly, sitting down across from me. This kind of difference, this goes beyond medical treatment. You could have just processed him through the system. Stabilize, operate, discharge, move on. That's what the system expects. That's what would have been efficient. But you saw him, really saw him. You understood that you weren't just treating a burned hand. You were caring for a human being whose entire identity was wrapped up in what that hand could do. He pauses, choosing his words carefully. The technical skills, The IV placement, the wound assessment, the sterile technique, those are important. We teach those, we test those. But what you did for Rafael Delgado, nobody can teach that. That comes from who you are, not what you know. That's the difference between being a competent physician and being a healer. I don't know what to say to that. Keep doing that, Dr. Webb continues. As you advance in your training, as the pressure increases and the cases pile up and you're expected to see more patients in less time, don't lose that part of yourself. Don't let efficiency strip away your humanity, because that's the part that actually matters most. He stands up, preparing to leave. One more thing, he adds. Rafael's case, the one where we couldn't restore full function despite doing everything right, that's going to happen again, many times. You're going to have patients where the outcome isn't what anyone hoped for, where your best isn't enough, and you're going to question yourself every time. So how do I deal with that? I ask. By remembering that healing isn't always about restoration. Sometimes it's about helping people find meaning in what remains. You gave Rafael time to grieve, time to rage, time to eventually discover a new version of himself. That time was the treatment. The physical therapy was important, but your presence in his pain, that was what allowed him to transform tragedy into purpose. He gestures to the book in my hands. That book exists because you cared. Those recipes will help hundreds, maybe thousands of people. The foundation he started will change lives. All of that rippled out from one simple choice you made. The choice to see a person, not just a patient. Dr. Webb leaves, and I'm alone with the book and the weight of his words. I think about Rafael's journey, about how he came to us broken in body and spirit, convinced that his life was over because his hand would never work the same way again, about how he fought through infection, depression, despair, about how he eventually found a way to be a chef that didn't require what he'd lost. I think about my own journey too, about why I became a doctor in the first place. To help people, yes, but also to prove something to myself. To show that the son of immigrants who worked 3 jobs to put him through school could become someone who mattered, someone who made a difference. But what I'm learning is that making a difference doesn't always look the way you expect. Sometimes it's not the dramatic code save or the brilliant diagnosis. Sometimes it's just sitting with someone on a roof in the rain because they need to not be alone. Sometimes it's being present when there are no words. Sometimes it's continuing to care even when the outcome isn't what anyone wanted. I look at my own hands, unburned, functional, capable. These hands will save lives, yes, but more importantly, they'll touch people. They'll offer comfort. They'll be instruments not just of healing, but of humanity. That's what Rafael taught me. That's what I'll carry forward. Not just the technical skills of wound care and infection control and surgical assistance, but the deeper understanding that every patient is a person with a life that extends far beyond the moment they enter my care. That my job isn't just to fix what's broken, but to honor who they are and help them discover who they might become. The next morning, I'm back in the ER. A new case comes in. A construction worker with a crushed hand, the fingers mangled beyond recognition, the future uncertain. I look at him lying there, fear and pain written across his face, and I think about Rafael, about what it means to lose the thing you think defines you, about what it means to find yourself in what remains. I move to his bedside, take his uninjured hand in mine. "I'm Dr. Reyes," I say. "We're going to take care of you." He nods, tears streaming down his face, unable to form words through the pain and fear. "Listen to me," I continue, keeping my voice steady and calm. "Your hand is badly injured. We're going to do everything, and I mean everything, we can to save it and preserve as much function as possible. You're going to meet with surgeons who specialize in hand trauma. You're going to get the absolute best care we can provide." He's listening now, focusing on my voice as an anchor in the chaos. "But I also need you to know something else," I say. "Whatever happens, whatever the outcome, you're more than this injury. You're more than what your hand can or can't do. And no matter how this turns out, we're going to be here to support you through every step of the recovery. You're not alone in this." It's a promise I can make because Rafael taught me how to keep it. The work begins, the surgical team is called, and I'm there, present and focused, applying everything I've learned about both medicine and humanity, because that's what we do. We save what we can, we honor what we can't, and we walk alongside people as they learn to live with both. Later that night, after the construction worker is stabilized and taken to surgery, I find a quiet moment in the residence lounge. I open Rafael's book again, reading through some of the recipes. Each one is more than just instructions for preparing food. Each one is a testament to adaptation, to creativity in the face of limitation, to the human capacity to find new ways forward when the old ways are blocked. There's a recipe for one-handed pasta making, another for adaptive knife skills using specialized grips, a whole section on using kitchen tools modified for people with limited hand function. But what strikes me most is the introduction Rafael wrote. This book was born from loss, from the worst night of my life, when I held on to burning oil for 8 seconds too long and destroyed my ability to cook the way I'd spent 20 years learning to cook. For a long time, I thought that loss was the end of my story, that without my right hand working properly, I was no longer a chef, no longer myself, but I was wrong. What I lost was a capability. What I still had was knowledge, creativity, passion, and purpose. What I gained, through the hardest months of my life, was empathy for everyone who faces physical limitations in pursuing what they love. This book is for you, for the home cook with arthritis who still wants to prepare meals for family, for the culinary student who lost fingers in an accident but hasn't lost the dream, for everyone who's been told they can't do something because of how their body works or doesn't work. You can. You absolutely can. It might look different than you imagined. It might require adaptation, creativity, and patience. But cooking, like all forms of creation, is about more than physical capability. It's about heart, and your heart hasn't changed. I close the book and lean back, letting the words settle. Outside, the hospital continues its endless rhythm. Ambulances arrive, monitors beep, lives hang in the balance while dedicated professionals fight to tip the scales toward healing. And somewhere in the city, Rafael Delgado is probably in a kitchen, teaching someone that their limitations don't define their possibilities. That's medicine. That's what we do. We meet people in their worst moments and help them find their way to better ones. We can't always restore what was lost, but we can always offer presence, compassion, and hope. And sometimes, that's enough. Sometimes that's everything. Sometimes the greatest healing isn't in the restoration of what was lost. It's in the discovery of what remains, in the courage to adapt when adaptation seems impossible, in the choice to create meaning from suffering, in the transformation of personal tragedy into service to others. Rafael Delgado lost his right hand, or at least he lost what that hand could do, but he found something more valuable, the understanding that he was never just his abilities. He was his knowledge, his passion, his creativity, his resilience, and those things can't be burned. They can only be refined by fire. That's what I learned from a man who came into my ER begging me to save his hand. I couldn't save it the way he wanted, but maybe, just maybe, I helped save something more important. I helped save his ability to see beyond the loss to the possibility. And in doing so, he saved something in me too. The understanding that being a doctor isn't just about what I can fix. It's about who I can walk beside. And that's a lesson worth more than anything they taught me in medical school.